Good afternoon and welcome to Zimbabwe Daily. My name is Yvonne Muchaka, and this is On the Spot, a program where we take a look at stories making the headlines. And in the story today, MDC Alliance Harare West Member of Parliament, Honorable Joanna Mamombe, and Youth Deputy Chairperson Cecilia Chimbiri will have to spend more time at Chikurubi Maximum Prison after a Harare magistrate denied them bail. Magistrate Mambanje denied to grant bail, saying it is not in the interest of justice to release them from prison. The two were arrested in Harare on Monday and charged with undermining the authority of the state. Zimbabwe's finance minister and Professor Mthuli Ncube has backtracked from his initial statement where he said private citizens will have to pay to receive the COVID-19 vaccine jabs. Prof. Ncube's comments had sparked outrage as the public questioned why the government would ask citizens to pay for this critical vaccine when it should be made for the public good. In other COVID stories, Zimbabwe will likely receive just over 1 million doses of the AstraZeneca Oxford COVID-19 vaccine in the first quarter under the COVAX facility, a document released by the organizers showed. Reeling from the second wave of the coronavirus with infections and deaths mounting, the Southern African country is expecting 3 million doses from the global facility meant to facilitate equitable global access to COVID-19 vaccines across the globe to arrest the spread of the virus that has killed over 2.2 million people globally. According to the document, Zimbabwe with 1,269 deaths and 33,964 infections as of yesterday will receive 1.151 million doses, while neighboring South Africa will receive 2.9, Zambia 1.4, Mozambique 2.4, Malawi 1.5, while Nigeria, the most populous nation on the continent, will receive 16 million doses. Health and Childcare Deputy Minister Dr. John Mangwiro has dispelled assertions from some quarters that government was understating the numbers of deaths from the deadly COVID-19. He says such reports were false, mischievous, and a clear attempt to cause alarm and despondency in the country. Dr. Mangwiro said there was no way government would conceal COVID-19 deaths, and the situation being presented by authorities was neither exaggerated nor downplayed. In the meantime, the MDC Alliance has said that the central government's interference within local authorities was hindering the effective running of city councils. Opposition Party Secretary for Local Government Cecil Zhizai called out Local Government Minister July Moyo and Provincial Development Coordinator Tafatswa Muguti for their tight control of council operations, which are disrupting its day-to-day running. We hear what Mr. Zhizai had to say.
It's very evident that the city of Harare is dysfunctional. It has been paralyzed by recalls. It has been paralyzed by unnecessary suspensions of mayors and deputy mayors and committee chairpersons. What is worse is that even the functionaries, the executive side of council has suffered as well. The town clerk suspended. There is no full complement of directors. The directors that are there and senior management at council are mostly working acting capacity. This doesn't bode well for efficiency. We have got proposals a clear proposal to, one, make sure that the minister stops interfering with activities at the city of Harare. The city of Harare should be allowed to employ staff based on merit and out of their own initiatives to suit their exigencies and needs. We also implore central government and provincial government, which in any case is unlawful, to stop Muguti from destroying councils. Muguti, the provincial development coordinator, is not working on development at all.
The Douglas Munzora-led MDCT has called for the lifting of sanctions, saying they were hurting ordinary citizens. The party spokesperson Witness Dube said this after their virtual standing committee meeting yesterday.
Yeah, total engagement. What we are talking about is to say we believe that these sanctions have got a tendency of missing the, the intended targets and actually affecting ordinary Zimbabweans. This is the feeling of the party. We are also looking at sanctions in the context of COVID-19 to say, do we really need to put Zimbabwe in that, invidious position of having to fight too many, to carry a lot of weight through COVID-19? We believe that the international community can actually, look at other options of assisting the people of Zimbabwe. Yes, we know we have nothing to do with their choice of policy decisions in terms of who they sanction and who they do not sanction. But at the moment, we feel that the country needs to be given a full opportunity to deal with the scourge of COVID-19, and sanctions may not really be part of what can give us a better chance of fighting this COVID-19. So we believe Zimbabwe must be brought back into the full status of a nation that is able to look after its population. However, what must always remain clear is that we are in total agreement with the international community that human rights must be observed by all. And every leader in a political position must always know that there are consequences to not upholding human rights in their countries. And we believe that our leadership, our political leadership, must not be left scot-free where they violate human rights. And we as an opposition are committed to fighting for human rights tooth and nail and all the way. Yes.
And every 4th of February is World Cancer Day, a global initiative led by the Union of International Cancer Control, UICC. Mr. Love Mo Makurirofa, the research, information, and publicity personnel at the Cancer Association of Zimbabwe, had this to say.
Causes of death globally, and it is number 2 following COVID-19. And it is also a disease that is also being recognized as one of the non-communicable diseases that are resulting in a number of increased deaths from COVID-19 due to its relationship with COVID-19. Today, the 4th of February, the world is commemorating the World Cancer Day, and it is a day that all nations put differences together and work together towards the prevention and control of cancer. Globally, cancer is resulting in about 10 million deaths every year, and this is very significant. And of these 10 million deaths, 70% are occurring in developing countries. And the cancer is also killing more people as compared to malaria, HIV, and AIDS, tuberculosis combined. And it is also projected that by 2030, cancer deaths can increase up to 13 million. So we do have a challenge as a world, and we need to work together towards prevention and control of cancer. Zimbabwe is also not spared. We record around 7,000 new cancer cases every year, according to the National Cancer Registry, and we also record around 2,700 cancer deaths every year, which is very significant. And we find out that of all these deaths, some of the deaths are actually from preventable cancers, such as cervical cancer. For example, cervical cancer constitutes a third of the national cancer burden among Black women in Zimbabwe, yet it is a cancer that can be prevented through screening, through early diagnosis and treatment. So we do have an increase in cancer burden in Zimbabwe. And again, in Zimbabwe, these statistics are actually underestimating the current situation. Why? Because these are the cases these are the numbers of people who have afforded to be diagnosed, yet the diagnosis cost is a bit unbearable to most of the general population. And as a result, a lot of people can actually live with the signs and symptoms without being diagnosed of cancer because they don't afford. So in 2021 World Cancer Day, our message as Cancer Association of Zimbabwe, it goes very well with the theme, I am and I will. So when we are talking of the theme, I am and I will, we are educating the people that they should identify their position in their own societies, and at the same time they commit themselves to a specific role to the prevention and control of cancer. And that is the theme, I am and I will. So the theme is I am and I will campaign for the prevention, early detection, and treatment of cancer. So you identify yourself. So this theme is emphasizing on the fact that we all have a role to play, regardless of our level of education, regardless of our religion, differences in religion or political affiliation, or whatever differences that we might have. We do have a role that we are supposed to play in as far as cancer prevention is concerned. So someone can actually say, I'm a journalist and I will help to spread cancer information. A teacher can actually say, I am a teacher in Zimbabwe and I will teach my students about cancer prevention and control. So we all have a role to play. So it is after we have united together that we will be able to control or to prevent cancer. So from the Cancer Association of Zimbabwe's information desk, we are reiterating this theme that I am and I will remain committed to the prevention and control of cancer. And we encourage the people throughout the country to play their role in as far as cancer is concerned. We need to support the cancer patients. We need to educate the people about the screening that is available. We need to educate them about the ways that we can utilize to prevent cancer. For example, the issues of healthy diet, the issues of having exercises, the issues of also prevention infections such as HIV and AIDS and human papillomavirus, which is also resulting in a number of cervical cancers in Zimbabwe. So the Cancer Association of Zimbabwe also joins the international community in commemorating World Cancer Day 2021, which is commemorated on the 4th of February every year. This year's World Cancer Day commemoration theme is I am and I will. This theme runs from 2019 up to 21. It calls upon everyone to act accordingly in the prevention and control of cancer. Truly, you and I can work together to reduce the cancer burden. Every step or action that we take really counts. The theme I am and I will remind us of the great inherent potential in us that we have to unlock in order to reduce the global cancer burden. The theme encourages individuals, corporates, churches, governments to take personal commitment to the reduction of the global cancer burden. It shows the world's optimism in the fight against cancer, and it calls for personal commitments towards any intervention that will help reduce the global cancer burden. Cancer is not beyond our reach, since we can do a lot in the areas of prevention, early detection, treatment, and care. It is a time that we need to take our personal commitment towards the prevention and control of cancer. So as Cancer Association of Zimbabwe, we take this opportunity to urge the government, to urge its partners, to urge members of the public, churches, religious bodies, and other stakeholders to step up efforts towards prevention and control of cancer and improving the quality of life of those diagnosed of cancer.
All right, so we need to step up the campaign against cancer, as it is one of the leading contributors to death in the world. So this is On the Spot program where we take a look at the stories that have been making the headlines. And this is Zimbabwe Daily. Do like our Facebook page, like our Twitter account, follow us on Twitter, subscribe on our YouTube channel, and also visit our website for latest news. On our platforms, we also share daily devotionals. As you can see, if you come onto our website, you will find everything there. So if you come onto our website, you will be nourished, you will be blessed, and also will keep you informed with what will be happening in our country. Also, do send us a WhatsApp message. Thank you so much to those who have joined us for the news. This is On the Spot, and have yourselves a blessed rest of day.